You don't need to suffer with pain any longer as long as Innovative Back Solutions and Dr. Bob Ruano are on your side.
Nice to have you here.
Thank you so much. And let's talk about Innovative Back Solutions.
In 2006, we created the practice based around a new technology at the time called non-surgical spinal decompression, a specific injury, and that is discogenic back pain.
Discogenic?
Yeah, not quite, Zach. Discogenic meaning degenerative, bulging, or herniated disc.
Yeah, and that's not a laughing matter at all.
Not at all. A recent study indicated almost 70% of chronic neck or back pain can be directly attributed to some sort of a disc lesion.
It had gotten really bad, a lot of pain. Trainer at my gym actually recommended that I come see Dr. Ruano.
I had ruptured discs, scheduled for surgery, was on my hands and knees for mobility, heard about Bob, came in and visited with him.
He figured out what was wrong with my back so he could properly treat it. And I did the decompression treatments. They worked great for me. I'm back in the gym.
I began to receive feeling back in my legs, less pain. X-rays post-treatment showed a complete healing and the regeneration of the disc.
Spinal decompression is, at this time, the only non-surgical approach to actually reversing some of these changes in the disc.
The amount of research I did, after 10 years, every patient, whether they had surgery or didn't have surgery, were at the same spot. The surgery was really out of the question. After 3 days of treatment, it was a miracle how great it felt. So I completed the treatment. I'm a new person now.
In 2011, I herniated a disc, so I know what it's like not to be able to get out of bed. And sure enough, I took my own medicine, and 4 years later, actually stronger than I was back then.
You just qualified for CrossFit.
The CrossFit Games, it did for my age group. So
that's a pretty big leap.
We're pretty excited about it.
It was about finding someone who really cared about treating what was wrong with my back and not just the symptoms, because I think a lot of doctors just treat the symptoms.
We do a thorough orthopedic and neurological evaluation. Any diagnostic studies that have been done, such as X-ray or MRI, really is the gold standard. The mechanism behind the spinal decompression is simply it gently distracts the vertebra apart, creating a vacuum in that disc. And that vacuum is what draws back the bulge or the herniation back into the perimeter, and also infuses that disc with oxygen and nutrient-filled blood, so now it can scar over and capture those gains, as opposed to a traction or inversion, which is a two-step forward, two-step back process.
It is.
This is a two-step forward, maybe one step back. Typical treatment protocol is 6 weeks. You'll be on the table for about 25 minutes, then we do an adjunctive therapy afterward.
Exercise therapy, you call it.
And what we do with the decompression is great to stabilize the disc, but then at that point we need to look at how is that spine functioning. We want to create a nice stable brace with your own
like working with the core, which is going to...
That's exactly right. Muscles that you see, like the stomach muscles and the back muscles, and the ones that you don't, and they're equally as important. These are intrinsic muscles that attach vertebra to vertebra. So to train one without the other really sets you up for failure.
Of course, you incorporate traditional chiropractic as well.
Yeah, absolutely. These discs don't have a direct blood supply, so they're limited on their healing capacity. So what circulation they do get is from joint mobility. Well, if the joints aren't moving, then that means that disc slowly dehydrates and eventually sets itself up for injury.
You brought in some new technologies as well.
Pro Adjuster, we're able to do mechanical scans of the spine, measure joint mobility, and if need be, make corrections.
The ability to, because of that machine, see on the screen what your neck is doing and all the way down your entire spine. And he sees where the adjustments need to be made, uses that tool and makes an adjustment, and it's like, okay, I'm good.
It's a new life. I can't tell you how good it feels to be without pain.
Call Dr. Bob Ruano, Innovative Back Solutions today at, what's the phone number?
It's 505-3993.
Okay, and you also have a website, and
That's GainesvilleDRX.com.
Now, Dr. Bob, let's go take a look at my back.
Absolutely.